The first thing, and this has taken on, I guess, a whole new meaning since we've entered this new COVID-19 age. Can you take me through some of the key points of your session from the Obesity Medicines Association conference regarding taking your practice virtual?
Absolutely. It was a wonderful experience, actually. My first virtual conference, let's say that, right? It's a very different experience, as you said, in terms of the current landscape. But it was nice to be able to bring, our key points to a virtual platform for providers to make it really applicable for them. Because, as you said before, it's a different place now. So the key points for what we were able to highlight. So I co-presented alongside Dr. Jeremy McConnell, who's also he's an obesity medicine specialist, advisor for InHealth Medical Services. So he and I were able to go through the position of what a lot of the questions are that these doctors have right now, which is how do I transform my practice hybrid, virtual, and how do I really operationalize it for workflow that works for me. So how we went through the presentation was basically from a high level, you know, why is it important? Of course, highlighting COVID and the current landscape. From there, we sort of took it into a place that makes sense from their previous background. So as a clinician working in, their private practice, hospital setting, whatever, what were some of the key challenges from before COVID that they now are starting to see that they could virtualize, right? So we kind of took this word and said, what could we virtualize in your current workflow prior to COVID? And now what has really come to the surface because you've been sort of thrown into the deep end and at this point in time. So you've had to rush to put something together. So some of the key points were going through, 5 key strategies of what needs to be accomplished in order for you to take your practice hybrid and or 100% virtual. So the first thing we identified was number 1, what are the things you're already doing in your practice and your workflow that you could already be getting paid for? So we highlighted key things like, text messaging or lab reviews, phone calls to patients, things that they've probably started feeling right now that actually they're probably missing out on revenue. So we were able to kind of speak to some of those. The second was being able to highlight how to leverage service extenders. So a lot of providers, again, in this current landscape, are trying to figure out what to do with their MAs or any other office staff, ancillary personnel, as well as how do I get a bigger reach from my practice. So the second part was really transforming the conversation into, why should we use service extenders? How could we use our current staff, or who should we outsource to? So from an in-health perspective, that's really important to us because that's where we function and where we fit really well, is that we're able to provide that service to providers in a virtual space. So we were able to give some key points on how they can do that, what we've done from experience, how a health coach could really add not only an additional touch point to their practice, but provide them with increased revenue opportunities, time-saving advantages, things like that. So that was great. From there, we went through different steps on what they need to accomplish within their current practice, which is, kind of some housekeeping that they need to do with their staff. What are they feeling at this time? How are they able to contribute? What are their thoughts? So we went through, I think it was about 6 different steps on the things that they need to go through to identify basically places in their workflow where they can automate, they can virtualize, or they can outsource. So there was 3 different basically buckets that they're able to identify on how they can really optimize their time or revenue or outcomes for patients. The next point that we talked about was optimizing outcomes. So a lot of what I do for InHealth is research and development. That's where I get a lot of my experience from, is being able to see how we can apply what's currently done in the research world into current clinical practice. So what we were able to identify is I was able to highlight, 3 different clinical trials, 2 that we've done with InHealth, as well as key collaboration partners like Pennington Biomedical, the NIH. We've gotten funding to be able to perform these different trials. So I was able to provide them evidence that basically telemedicine works, and it's very important for your patient outcomes, because the more we can touch them, right, with a virtual sense, so whether it be through video or whether it be through messaging opportunities, there's more ways that we can drive outcomes. And in our experience and with our research, that have been published, it's important for them to identify that, because patients, especially at this time, are having a really hard time with getting reconnected and connected to their providers. So by utilizing a virtual space, they're able to create that touch point, not only from their healthcare provider, but maybe from a health coach or dietitian or other ancillary personnel. So I was able to show some evidence for that, that they were able to relate to. I think I touched on all of them, but those were the key points. And then we just talked about research and how they can kind of implement that.
Okay, and it sounds like your presentation really went through this next question a little bit. But telehealth is something that in the past has often been difficult for some clinicians to incorporate into their practice. How do you tread that fine line for some physicians between implementing telehealth to make your practice as convenient as possible for your patients and doing so in a way that doesn't over encumber you?
Yeah, no, I think, excuse me, I think that's probably the most important takeaway that people that attended were able to take away with them back to their practices, is that telehealth can be super scary. And again, they've been thrown into the deep end right now. So they've had to come up with something, and they've probably identified things that worked okay and things that are not working well. So what we went through was, starting small is okay, right? So we're at a point where we've tried something. Hopefully most of them have tried something. But now what's the most important? How do we evolve from here? How do we make it a true patient experience that these patients are going to want to keep coming back to them? Because let's be honest, right? Even before COVID, there's been this industry revolution where everything has been on the palm of their hands of these patients, where healthcare has been taking so long in order to catch up, right? And so doctors always thought of this as a add-on, right? So telehealth was an add-on versus an essential need, whereas now they're saying this is essential. I need this. My patients, I'm not going to see anybody unless I do this at this time. So we were able to show them, just some key strategies on what they can do to encompass things that work within their workflow. So again, it was sort of the opportunity of how do we, what can we virtualize, what can we automate, and what can we outsource? So those are the three main ways that we kind of identified how they can accomplish that. For the most part, with these clinicians, they're going to gravitate, when we evolve from COVID, towards a hybrid model, because every doctor has a point where they want to be able to, there's reasons to touch patients and they need that, right? There's lots of reasons for that. And so we were able to identify, currently what we've been doing for several years, which is a hybrid model where patients come into the office at a specific frequency. Typically it's around a monthly basis with their doctor, or maybe to 3 months throughout the year, or 3 time points throughout the year. With our health coaches, they see their health coach 26 times a year, which is all done through telemedicine. And we were able to show them how those can be a billable event, which is very novel to a lot of clinicians in the obesity medicine space. We were able to show them that this is a billable event. They drive revenue. Those are things that are really important to doctors, as well as outcomes. So Dr. McConnell also had 2 other presentations about exactly how to go through that billing and coding process. We were able to show them in this presentation, how do you operationalize it? What does it look like? And most likely, these clinicians are going to gravitate towards a hybrid approach, but we also showed a 100% virtual approach and the different types of patient populations that could benefit from going 100% virtual. Because a lot of these doctors are now, like Dr. McConnell's one of them, he wants to see 80% of his patients virtually from here on out. And he wants it to be a part of his lifestyle. He wants it to be part of the culture that his patients are used to. And with all the key tools that we have now, like remote patient monitoring, it's very feasible. And there's a way to incorporate that. So we're also able to walk through, what that would look like for a clinician. Again, they would, depending on the payer population, they would either need to see that patient in office for their first visit, and then they can continue on the same workflow as I identified previously. Or if it's a different, like a commercial payer, they could do everything 100% virtually and establish their E&M visit through telemedicine. However, with the changes that have happened within the last 90 days with Medicare, a lot of that's been scrapped, and so we just don't know what is coming to the future. What of these new regulations that have emerged in the last 90 days? What is going to stick, and what's going to stay with us, and what is going to kind of fall off and go back into the old regulations of what have been put forward. So